don't always want to be recorded. So yeah, that just means we can share it as a resource for people that weren't able to make the session today. So we're going to give a bit of an overview of the background of the work and how we've got to this point and the process that we took to create this new resource package. And we'll share the resources with you and how you can use them in your practice and where you can find them as well. So first, I'm going to hand over to Alex Bevan-Nichols and Greta Brunskill, who are going to give the overview of a bit of the context because they were really involved in that work as well. And I'll just move the slides on for them and just let me know when you want to move to the next one. Over to you.
Thanks very much, Beth. Thank you. We'll just quickly introduce ourselves before we start. I'll introduce myself and then Greta if you want to jump in. So really nice to see everyone. Thanks for coming. My name's Alex Bevan-Nichols. I'm the Patient and Public Involvement and Engagement and Equality, Diversity and Inclusion Manager for a service which is funded by the National Institute for Health and Care Research. We're called the Research Support Service, and I work at a hub that's delivered at Newcastle University. So I'm based at Newcastle University doing that work. I'll just hand over to Greta briefly to introduce herself.
Thanks, Alex. My name's Greta Brunskill. I'm a Public Partnerships Manager at another NIHR centre in our region called the Health Tech Research Centre. Our research supports innovators to evaluate new and better diagnostic tests and technologies, and I support their public involvement throughout that work.
Okay. Thanks, Greta. So we're going to tell you a little bit about the background, just a brief bit on the background to some of this work. I know we want to get onto the more exciting stuff, which is hearing about the new resources that have been produced. But we're just going to spend a couple of minutes telling you a little bit about some of the context so that hopefully it all kind of fits together when we're telling you about the new resources that have been made. So if you could go to the next slide, please, Beth. Thank you. So I'm going to take you back quickly 7 years here to work that laid some of the foundations for the resources that we're really pleased to share with you today. The concept of public involvement in research was established at this point, and it's best kind of summed up by this quote here, no research about us without us. So research that is done with or by the public rather than to, about or for them. So this was established, this was an established concept. I don't have time to go into the whole history of public involvement in research today, but this concept was kind of there. And there'd been obviously pockets of amazing work, but there was also a sense that this could be done better. I think it's fair to say that patients and the public could be involved in better ways in kind of shaping that research, in shaping the topics, in shaping the questions, in setting the priorities, in having a say on how research is carried out and how it can be then communicated and put into practice at the end. So there was involvement, but there was a sense that more could be done, that involvement in research could be more inclusive and it could be more accessible for more people so that we can listen to more people's views in research. Researchers weren't always engaging in kind of meaningful or respectful ways with communities, and as a result, some people were kind of alienated from that process, and their views weren't being heard in research, in planning research especially. So yes, taking you back 7 years, 2019, National Programme of Work Reaching Out Programme. You can read more about that in some of the links that we send out afterwards. Essentially, this programme of work was saying, how can we do this better? Funding time to be spent between researchers and community partners to start having those very initial conversations about how we can do this better, how we can lower barriers to people getting involved in research. If you go on the next slide, please, Beth. This was the work that was being done there was being done by, there was a service called the Research Design Service, which was funded by the National Institute for Health and Care Research. And the Research Design Service worked with a lot of researchers at that early stage when they were just planning research. Some of them on the call, myself included, worked for that service. And my colleague, Jo Lally, who's on the call today, was coordinating this work, the Reaching Out programme in our region. So Jo and some other colleagues at the time went out and sat down with people and had these conversations. And there were 6 groups that she worked with in the region. These were, you'll see there that hard to reach at the top is in inverted commas. It was obviously clear at the time and becoming clearer that these groups weren't hard to reach. People just weren't going about it in the right way to sit down and talk with those people and involve them in health research. People were there, they weren't hard to reach at all. They were there just living their lives. And actually it was more about kind of how do we do things slightly differently to what is maybe the standard way of engaging? How do we do things slightly differently so that more people's views can be heard in research? So these are the 6 groups that Jo and those colleagues at the time went out and had chats with. So it involved people with experience of migration, some pregnant women, some people attending a mental health support group, some young people in a coastal community on the Cumbrian coast in Whitehaven, some council employees. So Jo went out and spoke to some of the bin workers, for example, at some of their morning meeting and said, do you want to be involved in health research? If you do, what would be the best way to work with you? Because it's unlikely to be those kind of standard practices that would become maybe a bit too reliant on, and farming women in Northumberland as well. So those were some of the groups, and that was just in our region. In different regions in England, people were working with different groups to try and find out what could we do to lower the barriers to people getting involved. If you could go to the next slide, please, Beth. And this was what came out of those discussions was the kind of very start of the work that you're hearing about today. This was the start of this community engagement toolkit that we've been kind of building on since then. And this was the first, I guess the first puzzle piece of this was getting some of those principles down on paper, those 10, and we came up with 10 guiding principles from those discussions, summarising all of those different community partners' views on how they would like researchers to engage with them to make sure that they were building inclusive and sustainable partnerships. These 10 principles were a good starting place for kind of, and they're still there and they're still available to use. And I'd still recommend definitely starting to look at them when you're looking at the Community Engagement Toolkit. So they can help shape those early discussions. What we first did was come up with a list of quite a boring list of these principles, took that back to community partners who told us, actually, yeah, we agree that you've kind of summarised well what are our priorities here, but the way that you're presenting them isn't accessible and isn't going to get people on board and isn't going to make a difference here. So actually, you need to present them in a different way. What were the outcomes of these discussions? So we involved an illustrator at that point who came along to some of these discussions, sat down and listened with people about what they thought was important, and came up with an illustrated version and also an animated version. And that became that kind of early foundation work to some of the resources that you're going to hear about later today. So that illustrated version of the 10 principles. And this is an example of one of them on the right. So do the groundwork and prepare was principle number 1, for example, but there was a series, there was 10 of these in total about kind of key things to consider for building early, inclusive, sustainable partnerships between communities and particularly voluntary and community and social enterprise sector organisations and researchers. Next slide, please, Beth. And I'm going to hand over to Greta now, who's going to tell you a little bit more about what we did next.
Thanks, Alex. So yeah, as Alex shared, we had this set of 10 really beautifully presented principles. And a couple of years ago now, we had the opportunity to take these out and spread the word about them, really. To do that across our North East and North Cumbria region, we wanted to go to kind of different places and spaces to do that as best we could. So we went to Newcastle first of all, also held an event in Carlisle and one in Spennymoor, which is in County Durham. And we delivered these as a Creating Connections network. So that's our region's patient and public involvement in health and care research network in collaboration with Vaughan. And importantly, we held these in community spaces rather than academic or research ones. And our primary audience was researchers and also voluntary sector partners working in the area with an interest in health research. Through funding from several NIHR research centres or infrastructures in the region, Vaughan and Durham University, we were able to host these events and support people to attend them and offer voluntary sector partners some financial remuneration for their time, given that health research is very rarely part of their organisation's aim and funding. And what this allowed us to do was to raise awareness of those 10 guiding principles and also provide an opportunity to learn from examples where people were already doing some brilliant pieces of work, of collaborative work, around health research in our region. So voluntary sector partners presenting with researchers together about how they had started their conversations. And it enabled us to open up a dialogue as part of these events about what else might be needed to support people to work in these collaborative ways across the voluntary sector and research. The events went down really well. I think we also really enjoyed delivering them. But across the 3 events, we were able to involve 53 voluntary sector organisations, and we had researchers who represented all of the 6 universities in our northeast North Cumbria region. So they had a decent amount of reach. Next slide, please, Beth. On the back of those events, as I say, they enabled us to kind of open up a conversation about these principles, as well as, in terms of next steps. And what people said was, gave the principles a kind of really good reception and that were really helpful. But what next is often what people said. So they were often kind of curious about how and how they might actually put some of these things into practice. And it was through this, I think might be another point for this slide, Beth, if you don't mind pressing again. So one of these points here was people were curious about, well, how would, as a voluntary sector organisation, what questions or what things should I be covering in my first conversation with a researcher to know if it's a good idea for us to work together or not, particularly in the context of voluntary sector organisations working under stretched capacity and increasingly wide kind of remits and demand for their support. So we heard these curiosities. I think there's another point, sorry, Beth, on the slide, thank you. And together with this, there was some national interest from the NIHR Centre for Engagement and Dissemination, as it was at the time. And they I guess were so interested, they were keen to support the opportunity further to develop these principles into some pragmatic tools. And so it was through this work that the project Beth's now going to talk about came about. So it was kind of, developing the principles further into some practical tools that people could use to put them into practice. Over to you, Beth.
Thank you. So, as Greta just mentioned, so we had an additional grant and this is the name of the funder now, the Coordinating Centre, but it was the Centre for Engagement and Dissemination. So we received this extra funding to co-produce resources to support those research partnerships with the voluntary sector and really apply those principles into actual tangible resources. So through this, we hosted 4 co-production workshops that were in Newcastle, Durham, and Carlisle. There was 2 in Newcastle, so there was 4 in total. This picture's from the one in Durham, and I think Ria's on the call, so he was in there. So it's nice to see people here celebrating this as well. And like with the original events, we remunerated people for attending and their travel, just to recognise that expertise and really value their opinions. And we wanted to make it a really informal process where we could work together and think about what would be helpful in people's work to bring this forward. So just to touch on the co-production process, this was really important as part of this work, that we didn't just assume what people wanted. So we had a discussion about the barriers that voluntary sector organisations had of research and what barriers that they had to engage in that as a bit of a starting point as to what is needed to address some of these challenges. And that original Community Engagement Toolkit and the guiding principles were used as that initial starting point to think about what was needed to apply these principles. So this led to different ideas about resources and the format for these. And then we kind of had the process where we'd share them at the next workshop, get feedback, and then we'd adapt them based on that feedback. So we tried to capture people's opinions and make sure that they were really reflective of the discussions. And then we drafted the resources in between and shared them via email and in future workshops, and then they were signed off. And then again, we used the same illustrator that we used for the original toolkit to make them cohesive and make them really visually appealing and accessible, because I think a lot of the resources that exist might be quite research focused and not necessarily adapted to the VCSE audience. So we're really excited to launch these resources, and I've just included screenshots of the cover pages of these, but we'll go into more detail of each one. But just as a general overview, this was what was created with like the input from those workshops. So the first one was this considerations before agreeing to an initial conversation with a researcher. And this was adapted and developed because of some experiences that VCSE organisations had where they were overwhelmed with requests for research, and they didn't necessarily have the capacity or resources to meet and pursue all of those conversations with researchers. So we thought, what framework would be useful to help filter that out and really decide what's worth pursuing. So this is where this resource was developed, and there was an idea to use a traffic light system. So it was like the green, or definitely things are really aligned with our priorities, let's explore this conversation further. And there was an amber where it was a bit unsure whether it would be right for the organisation, but might be worth pursuing. And then a red was a maybe next time. And that was also really important to empower organisations to say no and feel like they have that power to do that. And I think that's something that people found quite hard when you have a researcher approaching you and thinking about, if it isn't a good fit, how do you do that? So some of the illustrations kind of have some bubbles to show the best way to do that. And I've included links in the slides to each resource, which are available to download through the Creating Connections website. And then the next one is a bit of a follow-on from that first one, and it's a conversation guide. So looking at exploring a potential research partnership, and it's to support those initial conversations between VCSE organisations and researchers, with the aim of making sure that the key areas are considered and talked through at that early stage. And the background for this was experiences of VCSE organisations often wanting to be involved in research, but not knowing where to start and like what questions to ask. And this can create a bit of a power imbalance, or it might feel like the agenda is more likely to be set by the researcher just because they don't have that framework and guide to work through those initial conversations. And it's designed as a bit of a question with a box where it could be printed out and filled in during those initial meetings. But again, I'll show that in a bit more detail in a moment. And then the final written resource was this resource around the research process and the different points of opportunity for the VCSE sector. So we've got this diagram, which kind of gives an overview of what this aims to do. And this was based on one of the research process diagrams for PPIE, public and patient involvement in research. But it was felt like some of the language was a bit research heavy and used a lot of jargon that might alienate some VCSE organisations. So we thought, how can we like take that principle but make an accessible version? So we kind of printed it out and wrote down different words and made that for the voluntary sector audience. And it is intended to highlight the different stages of research and different ways that the voluntary sector can feed in. And often the voluntary sector is engaged at the later stages, maybe as a workshop or interviews and things like that. But this aims to show that you can actually be involved from an earlier stage, for example, looking at what research topic would be really good and what would benefit the community that they work with. So that's why this one was produced, and hopefully that will be useful in making people think a bit more outside of the box about how to work with VCSE organisations. And then finally, there's a little video. Well, it's 7 minutes long, but I won't play the full thing. But I thought it'd be useful just to share a couple of minutes of this video, which is designed to show examples of these principles and how different organisations have put them into practice. So bear with me while I just play a couple of minutes of this, and then I'll share where you can find them on the Creating Connections website in a second.
Community Engagement Toolkit shares 10 principles to guide researchers in planning for and working with community organisations for health and care research. It also provides a great resource for VCSE organisations to inform their conversations with researchers. But how do we put those principles into practice? Our first principle is do the groundwork and prepare.
When researchers have done their research, so they've looked up different ways to communicate with people, especially people with a learning disability and or autistic people, it just shows that the researchers, really care and really want to get it right.
We have very specific terminology that we use when working with older adults, so it's always lovely when a researcher gets in touch with a staff member beforehand just to know how to best approach topics.
Next principle is find trusted community workers and leaders who can help broker introductions with wider communities.
When we engage with researchers, if they are looking to speak to a very specific demographic, we do have networks within the Elders Council. If they are looking to do more activity-based research projects, we would direct them to search. So we've got this extensive network both within the organisation and outside of it. And I think we're really good as an organisation to know that if a project doesn't quite fit, then we'll make sure we always signpost the researchers on.
We get approached about community-based research, and we've supported Hindsight Mind, wanted to know better about South Asians' perceptions of mental health, and we helped facilitate for them to get connected to network members and to pay the network members to do their own research with their own community, which led to high engagement, trust and building up understanding around mental health, which is often a taboo issue. And then as a follow-up to the research, health and wellbeing sessions have been developed with those groups about the topics they raised.
Principle number 3 is...
So I'll just stop sharing that video, but we'll be sharing a link if you want to watch the rest of the video, but just to give you a flavour of the types of examples and things that are shared in that. So I'll just pull up the Creating Connections website next to show you where you can access the resources and how you can use them. So this is if you've not, hopefully you're all familiar with this, but if not, then we'll definitely be sharing the information. But this is the Creating Connections website. And as Alex and Greta mentioned, this is a network for PPIE in the North East and North Cumbria, but it also has really useful resources, not just these, but also other ones as well. So just at this tab at the top, there's a section for resources to support patient and public involvement and engagement. And it's worth having a browse of this. But for these ones, it's under the Community Engagement Toolkit section. So if you just click on this, then it opens this up. And the original toolkit, as mentioned, with the guiding principles is all here as well. So they're available to download with that animation as well, if you prefer to watch something. And then we've got a section about putting the principles into practice, which is where the new resource package sits. So if I just click on these, just let me know if it lets me open up. Is that updated with the next one? Yeah. So you can download them here. So as a PDF, so you can save them. And if you wanted to print them, if you're like someone that wants a paper copy, then that's available to do so. Yeah, so this is the first resource and the traffic light system that I mentioned there. So it takes you through questions like, does the topic align with our aims and priorities? And then the different categories to kind of guide you thinking about whether it's a good fit for this one's probably more for the VCSE organisation, but also maybe useful for researchers when they're reflecting on who to contact and maybe some of the pressures and challenges that the voluntary sector have in capacity for this. And thinking about what stage is the research at. Is it an early stage where you can really shape that, or whether it's a later stage where you might still want to be involved, but maybe not as a key partner. And then again, the no thanks for us this time. If it's not working, it's not a good fit, then it includes that as well. And also a question about what funding's in place for that activity. And as you can see, it's all illustrated as well and really accessible. These little pics are like my favorite. I think they're so adorable. So I'll just go through the next one. The next one's the conversation guide. So just to give a flick through, obviously you can look in more detail. This is the guide for VCSE partners and research to support those initial conversations. It talks through what is research, and was again links to information and things like that, and what you can consider when looking at this, what preparation is useful to make, and what areas we suggest you cover with little boxes where you can fill in the answers to that and maybe write it in if that's useful to you. So there's quite a lot of questions here, and obviously you don't have to go through all of them, but just to think about timescales, where it's come from, the question, what resources are available, remuneration, the feedback and things that's going to be given. And then there's also a little question around if they're aware of the payment guidance from the NIHR, which is really useful as well. And yeah, this one's a bit longer, but just hopefully includes lots of useful information and questions and things to help in those initial conversations. So yeah, this one's worth having a look through, definitely. And we've also got links within these to the other resources as well. And then finally, we've got the research process and points of opportunity for involvement of the VCSE sector. And this can be opened up and includes a full page of that diagram that I shared in the slide. And then we've gone into each part of that and maybe what that could involve, and it goes into a bit more detail. So for example, your organisation could help identify the research topic by looking at what matters most to the community that you work with, designing the research process, the grant application, recruiting participants and collecting data, helping analyse data and sharing research findings maybe to new audiences as well, and implementing the findings, and then a bit about evaluating the process. So that's the final one, and then there's also a link to that video where you can watch that full description and ways of working with community organisations in a really useful way. So I'll stop sharing that, and we can share links in the chat for that as well. Just pull up the slides. I think that's just about me done. I'll be ready to pass over to Jo in a second. So yeah, as I mentioned, they're all available to download on that Creating Connections website, and we'd be really interested as well to hear from you if you've used it and any feedback on that. And I've popped my email there if you want to share any comments on that. And also if you're hosting any events or run any groups where you think it'd be really good for us to come along and talk through the package and how it could be useful, I'm really happy to do that as well, because we want to share them far and wide, especially across the region and the different areas and things. So I'm going to pass over to Jo Lally, who's going to talk about the national picture and next steps for this work. Over to you.
Thanks, Beth. Just to introduce myself, so I'm, excuse me, Jo Lally. I'm Strategic Lead for Patient and Public Involvement and Equality, Diversity, Inclusion in the same organisation that Alex works for, the Research Support Service. And I'm also the National Lead for Patient and Public Involvement for the Research Support Service. So I've got several hats on today, and as somebody who's involved with many others on this call right at the beginning of this. So next slide, please, Beth. So I was asked to talk about next steps. So where do we go from here? But first of all, I wanted to reflect back really on this whole process. I've been involved in lots of research projects. I am a researcher by background. I still do research. So I've been involved in lots where they've said we've co-produced an intervention, we've co-produced a patient pathway, we've co-produced an output. And I thought at the time that had happened until I was involved in this. And I think that this is one of the few projects I've been involved in over such a long period of time has had co-production at its heart, that it's really tried to shift that balance of power away from the researchers and sit it firmly with the voluntary and community sector. And I think that's kind of the key to the success of this. And I think we shouldn't kind of forget that this really is a fantastic case study of how to do co-production being led by the community and voluntary sector. So that was my main reflection on that. The other one is that, and Alex mentioned this earlier, that we started this in 2019 with Reaching Out, which was meant to be a 2-month project. And here we are 6-7 years later. And I think apart from the longevity of that and the multiple applications for funding to keep this going, it really speaks to that process about relationship building. Because if we'd have just come and tried to do this in the 2 months that was originally set by NIHR, it wouldn't have been as embedded, it wouldn't have been co-produced, and I don't think it would have been as applicable or as appropriate. I think you need to work with the partners along the way and take people with you on the journey. I think if we'd have stuck with our initial ideas, it would have been those 6 communities, and looking at how we worked with them, we wouldn't have got this far. And we needed to build those relationships and take people with us, building the trust that we speak about in these resources. So I think we had to do what we were asking others to do as well. So I think it's important that it's taken that long. And I'm feeling very old that I was there at the beginning and now I'm here at the end as well. But at least said about that, the better. So in terms of what happens now and next steps, and to give you a bit of an insight into the national context, we had a meeting not long ago with our funders, and we spoke about how can we promote this nationally, because this works with any community that you want to work with. It gives you that guiding principles, that structure, that framework to use. So we wanted to really launch this locally first, because it's been launched back to the people that helped to develop it, and that was a really important step. So now that we've started that process, we will hope to then launch it nationally as well with National Institute for Health and Care Research. And then there's a stream of that organisation, NIHR, that looks at global health as well, and they're interested in launching it for their global health programme. So it's got a lot of interest nationally because of how appropriate and how applicable it is. So following today's launch, then we'll move on to that national launch as well. We need to get this out, as Beth said, far and wide. Now we need to promote it locally. We need to make sure that we're using it. I know I meet with researchers most days, and I'm involved with them at that very early stage when they're trying to decide what topic they're going to research, which communities they're going to engage with. And I've already started saying to them, you need to look at this toolkit. This needs to be your framework for having that conversation. So we need to try and embed that with all of the organisations that work with public contributors across North East North Cumbria. But as well as that, when we, probably about midway through this process, when we spoke to the community organisations, they were really enthused by it and enthused by the kind of rigour that this brings and the quality of engagement that this brings. And one of the things that they raised was, actually, we'd like this to become, I think they called it a code of practice or a minimum standard. So they wanted this to become the thing that all researchers, certainly in the North East North Cumbria, go to first before they start engaging with communities. So that for me is kind of a next step, really, is how do we get that out there, and how do we make sure that all researchers are using it so that it's being pointed to from the voluntary sector, but we're pointing to it from a research side of things as well, from an NIHR side of things. So I think that's how we need to look at that promotion, both locally and nationally. Myself and Greta and a couple of others are on a national group which links all of the infrastructure partners together. So hopefully we'll be able to take this to that national group to make others aware of it, so that we're not repeating, or other people are not repeating that. So it's important that we kind of raise the profile of this. And as Beth said, if you've got any training or workshops, anything that you're doing, it's an opportunity to raise the awareness and get people to use it. What we'd be really keen to hear from are people who have used it. There are some clips in the video that Beth showed of people who've done community work or used this in their community engagement work, but we'd like to see case studies of people who've used this, the good and the bad, and things that need changing, because this is it's an agile document that we need to be able to kind of build on your responses, build on your practical experience of using it. So we need to have some way of kind of capturing those case studies. So if you hear about people using it, if you try to use it yourself, if you've had success, if you've hit hurdles, then we'd really like to hear about that, because we think that it will need kind of improving and developing and additional resources maybe. So we need to hear from you about that. And that comes into that future development, kind of what next and what's the impact of this. We're all being asked to show the kind of so what question. You've used this, so what? What's the feedback from those community organisations that researchers have worked with? What's the feedback from the community organisations themselves about when researchers come to them and either have or haven't used this community toolkit? So that will help us in that future development. So lots of work done, but I still think there's lots of work to do in kind of promoting this and get people to use it. But thanks for giving me the opportunity anyway, Beth.
Thank you, Joe. Just a last slide from us. I'm going to hand over to Fran Molland, who works at VON as our Research Partnerships Coordinator. I can let her introduce herself just to share a bit about the work and support that links in with this, to give that full package of support and resources as well. So over to you, Fran.
Thanks, Beth. Yeah, as Beth said, my name's Fran Molland and I coordinate the research partnerships work here at VON. And it essentially sort of brings together everything that everyone's been talking about today. So the aim of this toolkit and of these wider resources is essentially to build those better research partnerships across sectors and make sure that each partner feels that their contributions are being recognised and that each partner feels that they're equal in that process. And this is not just an isolated project at VON. So the wider research partnerships work that we do provides that kind of single point of contact for if you are a researcher or you are a VCSE organisation who has accessed the resources or is thinking about engaging with communities in your work or engaging with researchers if you're a VCSE organisation. But you want that kind of more one-to-one support, you can contact VON and we're very happy to kind of support you regardless of what your research is about, as long as it has a health and care focus. If you're a VCSE and you have an interest in research but haven't been involved before, we'd really love to talk to you about how we can make that happen for you. And yeah, just kind of explore different points of opportunity for researchers and VCSEs to work together. So we know that every research project is completely different, and as is every VCSE organisation. So we like to be really flexible with the support that we can offer. But roughly, you can get in contact with us at VON if you want to connect with a VCSE or research partner. So if you have an idea for some research and want to know a bit more about the landscape of either sector, we can support with that. And then information around building a VCSE research partnership is very much based on the principles of the toolkit and the wider resources. They are kind of the framework that we use in our own work as well. So looking at things like how to remunerate effectively, how to have those conversations, how to build those relationships. And then we have different opportunities to share information about it being involved in research with our network. So we have our wider health and wellbeing network, which has, I think, over 1,000 members now of VCSE organisations in the North Cumbria region. And this year we also launched our research partnerships network and bulletin. That's a bi-monthly bulletin. So we're always keen for contributors to that, whether you're a VCSE or a researcher, and you have an opportunity to have do some of that more collaborative research or connect with other sectors. So do sign up to that if you're interested in receiving those opportunities, or get in touch with me if you have something to share across sectors. We also deliver training to both researchers and VCSE organisations on, what is VCSE and also what is health and care research, demystifying different concepts and different kind of areas of that sector to enable that sort of level ground when entering into those partnerships. And we also just offer one-to-one advice, skill sharing of resources. So if you're not sure what you need in building that partnership, just get in touch with us. We are very friendly and we'd love to kind of help you on that journey to doing more collaborative research. So you can either get in touch via our inquiry forms. We have 2 different ones for VCSE or research organisations. Like I say, you can contact me directly via email, or you can join our research partnerships network. And we're really happy to support with any questions that you might have. But I'll hand back over to Beth.
Thank you. So that's the content. So just thought it'd be good to have some time for questions if there is any. I'll stop sharing because I can't see anyone or the chat.